So there can be a lot of causes of male factor infertility. One of the more common is a varicocele. So a varicocele is where you have in what we call the pampiniform plexus, these dilated veins returning back from the testicle. And what happens is it creates too much inflammation and it creates too much heat, which damages the sperm, and it also slows down blood flow away from the testicle and the spermatogenic cells. And so then toxins have a greater chance of building up within that. And you don't have as many nutrients from the arterioles coming in because there's a backup from these dilated varicose veins in the scrotum. And there's various types. There's type 1, which is very minimal to mild, and type 2, which is more aggressive, and a type 3 or 4 where you could look from a distance and see their scrotum looks like a bag of worms. Basically, it's all these dilated varicose veins. And some of the best treatment of choice for that is to go in and do, a urologist to go in and do a selective venous ligation, where they select out some of these dilated veins so that the rest of the blood flow can go through the normal veins. And then you've restored that normal blood flow in and out of the testicle, and the temperature has reduced. Now some will just do, clamp all of it off, and if you clamp all of it or too many off, then you start to form what's called a hydrocele. It's a different type of hydrocele than normal, but it ends up being the same kind of thing. It just swells up, and so it's a fluid-filled sac, and now you've got a big fluid-filled sac after the surgery, and it's putting pressure on the testicle and creating heat also. And so if you have that issue, you ought to have that repaired and drained so that the testicle is more efficient at producing sperm.